Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient. Been dealing with cancer since 2021, doing very well. And I've chronicled my journey from California to Texas. And I've got a special guest from Texas, but she's actually in Georgia right now. But I'll get to that in a second. But hopefully, all of you have had a wonderful holiday season, and hopefully, all of you are healthy and happy and blessed. And why don't we get this show on the road? And I'm so excited today. I really am. I have a very special guest. As I mentioned, she's a fellow Texan, Dr. Neutrong. Please introduce yourself. Tell us a little bit about who you are.
Thank you, Mark, for having me. Thank you, everyone, for listening and joining us on this episode. And it's my honor. I'm blessed and honored and grateful to be here with you, Mark, and to share my journey. My name is Dr. New Trong, and I'm really transitioned from a clinical pharmacist who's, in the clinical pharmacist from the inpatient pharmacy, rounded with a whole team of physicians and making care plans for the patients, and then in charge of implementing programs in the retails. So I've done it all as far as being there and as a patient advocacy, and then my journey to holistic approach to really empower others to find their not only their purpose, but also live their life fullest and be in charge of their well-being and not just be dictated by what's being given to them in the Western world where a prescription, here you go, here's a pill for your ill. And if it doesn't work, come back and see me. So I'm very passionate about sharing my story, how I kind of view that as my approach and treating someone as a whole, as a holistic, their mind, body, and soul and spiritual. We have to look in all that, not just one dimension. So that is a bit of who I am and what I want to help others, Mark.
Oh, I I love that. Ill for your pill.
Yes.
Oh, pill for your ill. That's great. So why don't we start with your father? Can you talk about him and how that propelled you in your journey?
So when we first came to the U.S. As an immigrant back in the end of '91, and then really after, like shortly after a year, my father was diagnosed with um, not only kidney stone and then having surgery to remove it, and then after the surgery, they said he had liver cancer and he had 3 months to live. And at the time, not knowing the language, not knowing the cultures, not having the financial fitness to really go and figure out what's going on. Wait a minute, we didn't have that diagnosis when we, were back home, and they had a comprehensive, test to really test you before you go out to sea. And for the sponsorship program, because he was the prisoner of war. And so it just amazed me how now that urgency of that healthcare buff, how fast paced we are, right? Of here you are in the, your surgery, and then come back, here's another diagnosis that we didn't know you had. And so that is where I believe that not only takes my journey of my, I guess, my purpose that I always yearned as a little kid, to finding that purpose of me to be not only a servant leader, but also to help heal people. And that is my calling because that's my purpose. And that's what led me to going to this medical field and then holistic approach to help and save others. So that way they don't have to experience what we gone through.
So, in other words, your father's health crisis experience helped to propel you to do in your thought process to where you are today. Is that correct?
Yes. Yes.
Wow, that's And I see that so much from so many people that I interview, how their health situation personally or somebody else, how that propels them to want to really help people. And it's so great to hear what you just said about caring about people and wanting to help people, because I think what happens is with so many doctors is they get involved in the system and then the system sucks them up, and it's 15 minutes per patient, and we're human beings, and it's frightening and scares me because so many people just accept the fact that they're just literally a number instead of saying, hey, I'm a human being, and I'm a person and I want to be treated like a person. So can you talk more about that? Because I know you're
Oh my goodness.
very passionate about that.
Yes, that is what I'm all about because I see, I understand on both sides, meaning I've seen as a patient myself gone to, in the emergency room or family member being in the emergency room, but the healthcare providers, what one of the distinction is being there to take care of someone, like if it was their family, then you see that treatment, how they approach, how they talk to you, how they handle the care is different, right? It's just everything, the experience is different. But if you notice someone who isn't like that, who are just treating you as a number, oh, and my shift is in, or I'm here X amount of time, you see their treatment modality and their philosophy is totally different. And that is where I want to call people to really say, we got to pause and really reflect on who we are now and what would happen later if those who are, I get the system pushing you to being that burnout and tapping out. But then you have to think of you're not doing any, service to the patient because you're serving the patient to help them heal. But if in your mind you don't have that space mentality of I'm treating this patient with love, kindness, and I understand your pain. I want to heal you. It's a different than if you're in it, you give a pill or you give injection or you give a procedure, you just want to be done, right? And well, if they make it, they make it. If they don't, it's not my responsibility. I've done that I can. That perspective, that mindset is a poison to whatever you're doing. And it's toxic from the workplace, it's toxic when you bring home, it's toxic for how you deal with the patient. And that has to stop. And I want people to understand why you got into it in the first place, right? So that's what I feel like. That's why I want to help people to align, to understand what is your purpose in life. What are you here for? We have one life to live and we're all family. But if we can treat one another as so, with care, with nurturing, with love, with kindness, that patient dignity, right? That transition when they're older, when if you're there in that position, you're on the other side of the patient, how would you want to feel? How would you want to be treated? Would you want your family members to be treated that way? That is where I think not many people will really, really take it in their heart and soul because to go that extra mile to make sure things are done right, to wish them well, to give a little prayers. And even if you have different religion, you can pray in your head, right? You can have a prayers and have send that love, that healing energy to someone. It's totally different. And I really truly believe there's miracle if you believe and you have open to that, and we have to be the change. And that's where I was like, we have to be the voice. We have to elevate and say, we cannot be doing this. And the patient perspective, if you see those who are like that, you have to be your own advocacy, right? I feel really bad for those who are in that space who don't have someone to support them, to be there to support them. But really, you have to be it's like you have to know what's going on. And if something is not right, you tell your doctor, say, no, this is not right. No matter whatever you're doing, it's still not right. I'm feeling this X so and so, or no, this gives me some. You have to tell them only you know what your body likes and dislikes. And that is where I think people forget and either trust all right? Believe in everything that the doctor said. So that is like taking ownership. Take it back. You have all the healing power within you. You just need someone to have that little extra. Sometimes we do need it, but it's not all there. It's not, they're not the healer. I just want to, it, it's, sometimes it's really, what they call it, Mark, it's a guess. To be honest, it's really, if I'm giving you this medication, it's, it may work, it may not work for you. So it's a trial and error, to be honest, because everybody and every single person will act differently, right? Interact, and the treatment is different. So it may work for you, but when someone else, it's the same modality, the same treatment will be different. That is how we have to personalize. We have to get to know the person for who they are. What's all the going on with them? And that is not, you can't see that with a lab, right? You can't see that with just number. You can't treat a person with a number. That is how you have to get to know someone on a deeper level and to have a conversation further than 5 or 10 minutes, right? And so that is like,
How do you, let me pause you right there. So how do you manage, you know, every doctor I know is busy and they have 15 minutes to spend with the patient. How do you manage that in alignment with your philosophy? How do you deal with that?
oh, the philosophy, I would say, it's either you integrate it in a way of how you ask patients the question, right? Like you have to ask them the question to let them be open when you're in that treatment, not just saying, so how do you feel? Where is it hurting? Not just that typical, so maybe outside the box, like anything's going on with family, right? To know that if it's maybe they don't have any family members around, maybe they don't have, you know, someone to be able to give them that transportation. There's a lot of gaps that we have to be able to identify. And it's not the physician, it's the nurse, the MA that doing the triage. You can have all that works up and have all that before the doctors go see. So I've been, like, so there's a form that you can customize per doctors that you can customize and have the patient pre-fill out, like before they check in. This is what need to complete. And then when you complete that before the doctor see you. And that is something that I think we can also implement, even though it's a system busy, but you can implement, guardrails so that way they can kind of be able to explain. And that is like, for me, I think it's knowing how, if you look at that patient, it's not just a patient, but if you visualize and you think that's your brothers, your fathers, your kid, that is where you will go extra mile. You will want to figure out, you want to better than just, okay, I'm just going to give you this for your, your pain, your bleeding, your ulcer, your infections. You want to go further. And I think that is where we need to call out on healthcare is that having that empathy, having that emotional intelligence of to really serve to the best, not just in, because sometimes society kind of only look in a lens of IQ, like intelligence, how skillful, how smart you are. Yes, all that is necessary, but it's also being able to understand and empathize and being for that patient and really understand. Maybe that patient's like going acupuncture, right? Or maybe that patient doesn't like so and so. You have to figure out their fear. You have to figure out what they likes and what they dislike, so you know what the best treatment, so they can make sure they really stick to it. Because if they don't believe in it, they're not gonna take it. You can give them all the prescription and all the shots, but it's not gonna work. So that I think it's that mindset that we have to really get the engagement and patient really believe and feel the trust that you really care for them. The treatment will turn out different. And that is where I totally see the treatment on how you handle the patient is different. I, oh, I don't know if you've seen that, right? You've seen that in healthcare?
Yes, I have. I've lived it.
Yeah, because
Um,
you know someone who's in it for their passion. They have a passion to serve is different than if they're in it just as a career. They're making money to pay bills. It's different. I
right.
understand that we all have to pay bills, but your passion to help others go beyond that paycheck, beyond that 9 to 5. Sometimes it's okay, even if you go past that, but some people doesn't have that flexibility, doesn't go beyond that. And I think sometimes we need that flexibility. We need to know when someone really do needs us, and we need to reach our hand and say, I am here for you, right? And they can hear that. They say, oh my goodness, you understand me. I'm not alone.
Let me pause you right here. I mean, I've talked to quite a number of doctors, and I've never talked to a doctor like you. I mean,
Oh,
you are special, and I'm just so honored that you are here because I think many of us, who advocate for cancer patients and things like that have wondered if you existed, because uh, I'll give you an example. Um, when I was diagnosed, my oncologist told me that my cancer was so bad that she couldn't cure me, and she's said, I suggest you get your affairs in order, which, I really didn't care at that time because after going through weeks and weeks and weeks and weeks of testing, I just wanted to know what I was dealing with. So I was okay with it, but I didn't, I heard her, but I didn't internalize it. It just kind of went in one ear and out the other. And so when just before I left California, and I've told this story before, but just before I left California, I made an appointment to see my oncologist because I wanted to thank her in person for helping me and to just see the look on her face. I told her thank you. Her name, well, I'm not going to mention her name, but I told her thank you for playing such a big part in helping me get better. And she was speechless. She didn't know what to say because she knew she didn't do it. And so, but I was okay. It just felt in good to me in my heart to be able to. She did play a part, you know. What I see that she did was, I did go through 6 rounds of chemo, and by doing that, it allowed me to get ahead of the cancer, and then it allowed my diet to work, which is what I was hoping would happen. And so, just to help me to get ahead of the cancer so that I could deal with it in my own way was really important. And so I conveyed that to her. But just to see the look on her face when I told her that she played a big part and she knew in her heart that she didn't. But that was okay because in my heart I was grateful because you know she did put me through all the tests. She did find out where exactly everything was. And so, for that, I will always be grateful. But, to hear your perspective, it's just it's so refreshing. And I've talked to so many people about it, and we all wish for the same thing. And to hear it coming from you, it's just absolutely fantastic. And so my hat's off to you. I commend you beyond belief. So thank you very much for sharing your perspective, which is awesome.
thank you. And I truly believe that I think I was meant for to go through different, ups and downs in my journey to really be there to help, that's my calling, I think, to awaken all the healthcare providers who are numb to the system, right? To being burnt out and saying, oh, the system, they blame it on the system, but either the system, then you have to create a ways to be innovative, find ways to help the people that you want to serve. So whatever that in your environment, if you have the urge to really help, then maybe open your own practice, or maybe be innovative and create on your committee to say, hey, how about we implement this to help patients? There's got to be a voice to say we cannot be continuing doing what we're doing and knowing that is the right way. It cannot be, right? So we have to be the change. When I say you got to be the rebel, or you got to be the one who say you can't just go with the flow and just be quiet if you know that it's not serving your patient. And that is where like my calling and my heart aches for people who are either lost, who don't have that patient support system, don't have anyone to really be there, and have gone through that journey already tough as enough, right? Having to diagnose with cancer and not having someone to really care that they are human being that going through this traumatic, life changing, and they don't know what to do. So there's a lot of things, not just the physical body, there's mental that they need to adjust to what's going on, what will happen to them. So it's not just treating that little part of their body or their illness. And I think it's looking at a patient as a whole. So when you look someone as a whole, as you are my brother, you're my father, you're my kid, I'm so sorry that this happened to you. How can we figure it out, right? What route we should go, and then, seeking expert, but also that is where I think that genuinely care, that you love and care for others, it come through. That healing will come through. And the power of prayers. Not many people talk about that. I believe in miracles. I believe in things that are outside our traditional, surgery and pill and all that. So that is where we have to be, even though it works for us, we need to be the one who say, hey, we got stories to tell you where miracles happen, like Mark, right? That they're diagnosed to say how many X amount of months or whatever you have left. There's other modalities that work for you. Figure what that is. Who is your champion that will support you through your journey? Find the people that will care for you, because if you feed with positivity, you will raise your energy, your vibration. All that is different. You have the willpower to live. You have hopes. You have someone out there and say, oh, someone does care for me unconditionally. So that is different. Then no one care for me when I'm going through this hole, right? That that lives hit at them. And I think that is where we need more people to say, we are here, to elevate our voice and say, we are here to help you. Let's figure it out. Let's hold hands. Let's be a support system, and let's, be there. It doesn't matter what your gender, it doesn't matter what our race, our color, our religion. Let's remove all that barriers, and let's come together as one, and let's figure it out. Let's love one another more. And that is what we need. That's
Wow.
how we can
That
help
is
people.
so incredibly beautiful. And to hear a doctor actually say what you just said is just I'm beside
I thought
myself.
that everybody should be that way. It's not just a doctor. Everyone should
No.
be.
Yes, you are absolutely right. Um, let me say this at this point. Would you, we have to have you back again because there is so much more to talk, and I think you have so much more to share. Would you come back and share some more time
Yes,
with our audience?
I'll be honored. I'll be glad to, Mark, because I love and adore you, and all the people not only follow you, and I believe that the universe bring us together for a reason. I truly do. And for whatever reason, people who are listening to us, and find healing, find love, find the courage to move on to the next day, right? Because we are here for you. Just reach out, because it's not enough love, but we are here. And we stand every day because it's my soul, Mark. It's like you speak in my language and you're speaking my language. Like, what other way should someone be? It has to
Yeah.
be that way.
Yes, absolutely. Uh, I am so thankful that you're here. Um, why don't you share with us what your final thoughts are for this interview today? Um, and then I have another question for you after that.
Um, my closing, you want me to have a closing to
Yeah,
really wish.
what is your final thought for this particular interview that you want to share with the world?
I want those who are listening to us to know that whatever you're going through, know that you are going through this phase for a reason. Because once you overcome and out of it, you will know that you're meant to be in that position so that way you can help others. And as we unfold and when we share more story, you will see that life happens for you for a reason. So you can help others, so you can lift others up, so you can serve others because they can relate to your pain. That what you gone through, I know it's difficult, but know that someone care, love them and think of them and send love and prayers because for me, every day I pray. It's not just for my family. It's part of my DNA, part of my blood is I send out prayers for every human beings, all sentient beings to have not only be healthy, happy, and have no suffering. And suffering is not just a physical body, suffering is your mind, body, and soul and spiritual. So I really do hope that those who are listening to us have peace, always find joy, find love, and know that someone's out there is always here to support and cheer you on your journey. And so much love and much prayers for everyone. That is my little note.
Let me say at this point that without question, you are my dream doctor.
Oh,
You absolutely are. I've dreamed, I never thought it was, honestly, I never thought it was possible to meet a doctor with your mindset, with our mindset. And so thank you for being you and for bringing this light to this medical community which needs it. And you're such a breath of fresh air. And I commend you. And I'm so happy and I'm so honored to have you on because it's people like you that help make the world a better place. And so my final question is this. How does Dr. New, how would Dr. New help make the world a better place for everyone?
wow. That's a big question, Mark. Uh, wow. I think for me to answer that question, it's knowing in my heart that I've done not only my best, but also if I can save one life in one moment at a time, to know that we may not know everything and we may not find everything to cure whatever it is, but know that there is always a reason, a purpose. So when you look on a higher perspective of there's more higher divine, whether you believe in God, Buddha, or the laws of the universe, I truly believe that everything happens for a reason. And when you cross a path with us, like with Mark and I right now, I believe that there's always a frequency, there's a calling, and it's that message is meant for you. And I've touched so many lives, Mark, and that lives can be across the world. That here my message is the healing. It's a healing because when people don't believe in miracles, but the miracle of your prayers, you send out that prayers from a really authentic, pure heart. to heal someone, you generate that so much out to the universe. The people in your lives are touched around your circle. So I truly believe the more we uncover and help people to really hone into their spirituality and their inner works, they have all the healings within them, Mark. We just need to help them understand that they have it with them and have confidence and understand their bodies and listen to there's higher divines or maybe a message within your lifetime. But I truly believe that is how I reach and I help people beyond the four walls of the constraint, how the universe brought us together closer than ever. So I'm always grateful and always blessed. And that is how I help one patient at a time, Mark.
Oh,
It's
that's phenomenal.
every interaction, so Mark, it's literally because people felt like it has to be in the office. It does not have to be in the office. There's people who healed over, they call it telemedicine. So people do it through remotely. So people are able to not only help someone and heal the journey, and that is the powerful of our technology, and also to bring our healing and vibrations, energy sent out to the universe much more. So I'm just blessed to have a little saying in this with you. I'm so glad that we met, Mark, and now not only our journey are combined, and I'm so can't wait to see all the things in 2024 continue, right, Mark?
Absolutely. Absolutely. Wow. Thank you. Thank you so much, Dr. New. It's been absolutely phenomenal. And I want everybody to watch this. This is really, your message is absolutely great. So thank you so much. We're going to bring you back again to talk more because Dr. New is also an author. So we're going to talk about some of her writings and some of her other philosophies. So thank you so much. And I'd like to thank everyone out there for joining us here at To Be Your Own Hero. Please subscribe, like, make a comment in the comment section of the video. And thank you so much for your support and for joining us here every week on To Be Your Own Hero. I hope everybody has a very blessed week. Be great and do things for others. And we will see you next week on To Be Your Own Hero. Thank you very much.